Hi, welcome to BariNation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hi, friends. Welcome back to the BariNation podcast. If you're watching this on YouTube, you know today I'm joined by a long-time member, friend, and volunteer of BariNation, Miss Christine Mason.
Hi, everyone. It's great to be here.
We just returned from this year's ASMBS conference, where we got to meet in person the new incoming president, Dr. Richard Peterson. Well, we had the honor of interviewing him before the conference, and he shares with us his mission and vision and theme for his presidency. He's going to join us today, and he's going to share with you how he arrived at it and how he envisions living out his goals for this year. Christine, what's kind of your big takeaway from our conversation with him today?
I think that Dr. Peterson is someone who is so dedicated to the health and wellness of everyone, specifically those of us who suffer the disease of obesity. He's had a long, distinguished career that has been on the front lines of this disease management and working with a variety of chapters and organizations within obesity medicine. His dedication to the American Society of Metabolic and Bariatric Surgeons is years long. So he has been able to really take the information that his predecessors have started and be able to build upon them. And what we're really excited about is that we're going to be able to share that with you right after he has announced his platform to the medical community that is focused on this disease and its management.
He really is thinking about you, about us, patients, first and foremost. His mission, his initiative, and his theme this year is grounded in patient care and support. So we're thrilled to be able to introduce you to Dr. Peterson today. And know that at this year's ASMBS conference, we were able to present 2 times on what practitioners can do to help their patients lift shame and stigma around revisional surgery. So we're excited to be sharing all of that education and more, all the things that we took away with you this year in this podcast and in the BariNation membership community. So stay tuned for all of that. All right, friends, here's this amazing episode with Dr. Richard Peterson. Hello, friends. Welcome back to the BariNation podcast. Today, we have an extremely special episode for you. Dr. Richard Peterson, the new president of the ASMBS, is joining us. Hi, Dr. Peterson.
Hey, how are you?
Good. We are so thrilled to be able to welcome you. This episode is dropping really the first official week of your presidency of ASMBS. So we're honored to have your time, and we're very excited to be able to share your theme and initiatives for your upcoming presidency with the BariNation world. So thank you for taking the time to join us today.
Yeah, well, thank you so much for the opportunity to meet with you and talk and hopefully, spread the word and, get everything out there that we're hoping to be able to share with everyone. So thank you.
Yep. Well, that is definitely our mission today. Before we dive into the meat of our conversation, will you take a moment, Dr. Peterson, and introduce yourself to anybody that doesn't know you yet?
Oh, I appreciate that. Yeah. So I'm Rich Peterson. I'm a bariatric and metabolic surgeon in San Antonio, Texas. I'm currently the chief of metabolic and bariatric surgery here at UT Health San Antonio. And I have been, with ASMBS. Wow, it's been a long time. It's almost 20 years, I guess 18 to be exact, and have done my best to serve in some leadership roles all along the way. And obviously, this last few years have really put me into a different position to be able to do what I hope is to be able to help more people.
So, what is the role of the ASMBS? How does it help everyone, better treat the disease of obesity?
That's a great question. The ASMBS, at its core, they have a mission, right? We have a mission statement. It's to enhance the well-being of individuals affected by obesity and associated illnesses through the progression of surgical techniques, as well as other medical interventions. So we understand that. And again, the vision is to improve global health and quality of life, to reduce the impact of obesity and the obesity-related illnesses that go along with that. And that's not just here, but we do promote worldwide. The ASMBS is the largest metabolic and bariatric surgery organization in the world, as far as an individual organization. We are also the largest chapter of the North American chapter of a global organization called IFSO, which is the International Federation for Surgery for Obesity and Related Diseases. So it's a real honor. We're working together, here at home, getting the message out globally, but then also working on that federation level globally.
And from what we've seen, we've now been a part of the ASMBS for 3 years now. When this episode is dropping, we're actually with you in person at this year's conference. We've been asked to speak twice on how we can reduce shame and stigma around provisional surgery. From our patient experience, right, the ASMBS is critically important because you're setting guidelines for patient care, right, standards for care. You're advancing surgical techniques, whether laparoscopic or robotic, and you are introducing surgeons and really everybody in obesity medicine world to the most recent advancements in care and treatment. So it's a critically important organization. And I think sometimes from the patient perspective, we just don't understand its role, but it is something that we need to be aware of and be as involved with as we can, because what the society is doing is having direct impacts on our lived patient experience.
Right. And, I love that you say that. I've been, again, like I said, I've been a part of it for a very long time. And, I started out really locally here in Texas in our state chapter. And our state chapter at the time, that was before the ASMBS had created individual state chapters. Texas, there was a couple of other states, I think 3 other states that had sort of seen the idea and did their own sort of state chapters, if you will. But the benefit was when we first started, it's called TABS, Texas Association of Bariatric Surgery. They had a patient component of that conference. And I think that was really nice. It was a challenge though, right? It was a challenge for patients, and then to have a didactic conference at the same time. And so ultimately that kind of broke apart a little bit. But then, that was organizations like the OAC, for example, had their conferences. And so there was an absorption of that piece. So it wasn't lost. One of the things though, my first role in the ASMBS was as chair of the Public Education Committee. And so ties right back to, patients. We want to educate the public, and the ASMBS has been striving for a very long time to be the forward-facing place for people to come for answers. Obviously, the internet is what it is, and you've got TikTok and Instagram, and I was Facebook. That tells you how old I am. And then I jumped onto Twitter, now X. But the reality is those social media platforms, I think, reach out to our patients or potential patients much more rapidly. However, during Dr. Lemaster's presidency, which was, she's our senior past president, or was our senior past president now at the time of this, one of her initiatives was to put forward a website that was very user-friendly for both professionals as well as our patients, or potential patients, for the public. And so now if you go to the website, the ASMBS.com, it's basically, you can see exactly 2 spots, patient or your health professional. Helps you split that out.
Mm-hmm. The patient resources and education that's available on the ASMBS website is really extensive. So if you're listening and watching this podcast and you're thinking about undergoing a bariatric procedure, every type of surgery is outlined there. There's education specific to that procedure. And if you're post-op, there's information there about how you can really maximize your tool, how to have conversations with providers and practitioners. So it's a phenomenal website, and it's absolutely linked in our show notes. So if you'd like to check it out, just open up the show descriptions and it's linked there.
Yeah, and April, I apologize because I know I said it, and as I said it, I was like, I don't think that was right. It's asmbs.org. So just again, little thing. I'm sure you'll have it down in the comments and whatnot. But so if someone was just listening, it's .org.
Oh yeah. No, we'll make sure we direct them in the right spot.
Thanks.
Dr. Peterson, we had the great good fortune of having Dr. Ann Rogers, your predecessor as the president of ASMBS, lead a very spirited discussion with April and Jason on her initiatives, which was to reduce shame and stigma around obesity treatment and surgical options. And I'm sure right now she's doing a little happy dance that you're the big boss in charge right now. So where do we go from here? What's your plan as we're moving into a new year of the ASMBS presidency?
Yeah, no, I love that. Yes, and Dr. Rogers is very spirited. I love being and working with her. Her and I have been friends for a very long time. And so, the ASMBS is my family. And so it is a really nice place to be. So, if you see us all working together, you totally get that and see that. And, I would say, while I'm going to have, and we'll talk about those in a second, my own initiatives, one of the biggest things is that each president continues to carry those projects forward from the last president, which is a unique thing in our organization, because when you're elected to the vice president role, that's a 5-year term, basically, that you're signing up for. You are the vice president, then become the president-elect, then you become the president, immediate past president, and senior past president. So there is a progression, and there is a very intentional purpose for that, which is, when you first get there, you start thinking about things you're going to be doing, but also you're involved in the other projects that are there so that you can continue to carry that message. And the projects that are the long haul, the 5 years, kind of thing, they get done. It's not just left to one person. It's not one lift that is left, undone. So on that note, right? So the trying to stomp out the stigma of obesity, which we all face, every single one of us, and patients face it horribly because it's a disease. Obesity is a disease. It is not a problem. It's not a willpower issue. It's not I don't want to exercise. It's not I'm lazy. It's none of those things. And that is propagated in our, throughout the community, and that is it's just not true. The truth is it's a disease. And so big parts of our public education campaign and what we put out there is to go out and try to educate people that it's a disease, but also educate, those people who are caring for people that it's a disease. Because we have there's a huge bias, not only, within the community, but also in the healthcare community, right? There's a challenge there. So, we've had a change in the way we're seeing the disease of obesity being treated. Everyone is kind of seeing how, the new anti-obesity medications coming forward have had a large impact, and there's some unintended consequences to that. One of which is that surgery numbers have gone down. But what would I say is the most positive silver lining of that, more than anything, is that people see obesity as a disease now. Because you know what? There's a pill, there's a shot. So then it must be a disease if you could do that. You talk about surgery and it's like, surgery for that? But, I'm going to be biased. I've been treating the disease of obesity for 20 plus years, right? So, I was very ingrained into me as a intern, my very first year of residency. I saw, we built a bariatric program, and I've seen it for a long time. So when I tell people, I've been treating this disease for a long time, it was 2013 when the AMA said, hey, this is a disease. And you're like, okay, thank you. Yeah. But it's still there. The bias is still there. You try to get past that. And I've been talking to colleagues, and we're very blessed in Texas that we have a WhatsApp group for surgeons that they're able to communicate and just talk about, hey, this weird thing came up, or have you guys seen this, or have you seen that, or just talk about other things. But in general, it's just a way for some kind of rapid communication amongst colleagues. But one of the things, I kept hearing over and over is, my practice is suffering. We're seeing decline. How are you guys doing? What's going on over here? and, realizing that it's impacting everyone, and it impacts everyone a little differently. There are definitely programs that are doing well in this era of the anti-obesity medications and the surge of the GLP-1 receptor agonists. However, there's a concern that the ASMBS hasn't heard that message. And I can tell you, we've heard it. Okay. We've heard it, and we see it. We know it's there. And our numbers that are out there, hopefully we're delving into it to truly reflect what's really going on. But what I felt was more important than anything, and I'm so long answer leading up to my theme of my year. Okay. But I tell you, it did come to me.
Oh, good.
Okay. The issue was, I did some visits on the Hill, probably about 8 months ago, and I was paired with a patient. There was a nurse with us. I was with the executive director of TOSS. He's actually out in this local area of San Antonio, but we flew 1,500 miles to see each other. So we're going around and doing our visits, and we were talking about, advancement for, treatment of the disease of obesity, and really being specific about, we know surgical, procedures are covered, but medications aren't very well covered, on that level. So we were I'm a surgeon, but we were advocating for all levels of treatment, the continuum of care that is required for patients with this disease. And the patient who was with us had not had surgery. She had had very great success using medications, but she was desperate and fearful because her coverage was no longer available. Right. So she'd been on something that had worked very well for her and now no longer had coverage. So that's one. So pin in that part right there. Keep that in mind as we talk about it. The next one was surgeons, and practices saying, I don't know what's going on. Our numbers are down. How are you going to help me? What are we going to do? So if you're not familiar, one of my background is, so I was a resident. I was an intern, September of 9/11. Okay. So I was there, in Baltimore. And so it hit me and impacted me severely, I guess. And I always had an inclination to join the military, but in my third year residency, I commissioned as an officer in the United States Air Force. And so I've always had that in my mind anyway. It's kind of how I grew up, but that was important to me. And so I served my military time. I did my fellowship, then I did my military time after that. So I was a bariatric surgeon in the Air Force, but also trauma surgeon, for the deployments. So at the core of me is, if you're in battle, you don't leave a fallen soldier behind. And so the theme for me is leave no one behind. And that means we're not leaving our patients behind. We're not going to leave our practices behind. We're not going to leave each other behind. No one is left behind. So that's my commitment to to our membership, to our patients, that we are going to go forward and we are going to make sure that everyone do the best we can to get everyone access, to improve volumes for everyone. And that's one of the problems, right? There is the volume. We talk about only treating 1% of all patients who are eligible for metabolic and bariatric surgery, but we haven't moved that needle. And I'll get, that'll be part of some of the other initiatives we'll get to in a minute. But that's part of it, right? Is people are there and people can benefit from this therapy, right? From this treatment, continuum of treatment, but we're just not getting through. And so we are leaving lots of people behind, even though we're not intentionally doing it. So how do we move that? And I think that's something else we're going to be talking about.
Wow. It is such a powerful place that your theme is coming from. And I'm so grateful that you took the time to really explain the backstory of it. To know that your theme for this medical society is so deeply grounded in that patient experience is beyond inspiring for us to hear. for so many years, I think we felt the patient, that our voice wasn't a part of the discussion, or we didn't feel it had a place, or we felt it was discounted by people even in the medical community.
Mm-hmm.
But for you to say, when I was on the Hill and I was advocating for obesity treatment with somebody that lost access to care, regardless of what that initial care was, is the inspiration behind it is just unbelievably empowering. And what an amazing place to start your presidency from.
It's funny because I came in as at the time when I was elected, it was called Secretary Treasurer. We've done some organizational improvements. I think overall we're no longer an executive council, but we're actually a board.
Mm-hmm.
And the 5 presidents serve as the executive, the board executive committee.
Yeah.
And so I came in really, I had no plan. And I mean that purposely. I mean, I was a blank slate. I didn't have an agenda. I didn't have I must do this. Like, I had ideas, but I let them percolate, for the first 2 years, as, the now vice president and president elect. And so as you're getting to that time, and it truly was, at least the theme for me became somewhat of an epiphany, because again, I had those experiences. And then as I was chatting with my colleagues in Texas in the WhatsApp group and just hearing this concern and the pleas and cries for help, you don't leave people behind. You just don't do that.
Yeah.
And so I was like, wait a minute, what a great idea. And I'm like, no, this sounds kind of corny and hokey. And then my buddy who I was having the conversation with, I was like, okay, let me just throw this at you. Does this resonate? He's like, oh my God, that sounds great. And then I had another conversation, and then I talked to our executive director, and our vice president for strategic governance, who's part of, a lot of our calls. And I'm like, okay, ladies, just tell me. I mean, it's a little bit much, right? And they were like, no, we love it. We love it. And I'm like, well, good, because it came from somewhere organic. It wasn't just made up.
Yeah.
Because I kept feeling like, oh my gosh, I have no idea what my theme's going to be. I got to make something up. It's got to sound important. But it just, I think to me, it resonates more because it came from a place like that.
Well, and it also, I think it comes from your lived experience, right? Serving in the military, understanding that we get the most out of life when we kind of pay it forward. Yes. But we also can't succeed. It's not an army of one. It's an army of many. And yes. It's why we are BariNation. We are a nation of patients. And when we come together as this collective, we can create the change. We can make the things that we know that we need. So your theme speaks to everybody who's involved with this mission to not only treat the disease, but to make sure more people have access to it and actually go forward with treatment. That leave no one behind. It speaks to the surgeons in your WhatsApp group, right? You're coming together as a community to problem solve. You are saying we are here for everybody who's treating the disease, not just specifically a certain type of surgeon or somebody performing surgery in this way. If you're treating the disease of obesity surgically, we are here to support you. And it also speaks to what we see patient communities doing, like what BariNation is doing. It is leave no one behind. It is to ensure that we are reaching ahead when we need help, but that we're also reaching behind us to say, oh, we're in this together. This is again, a leave no one behind scenario. So I think it makes perfect sense, and it resonates with everybody on so many different levels.
Yeah. I mean, come from an era where, you do, it's kind of, you were talking about both reaching ahead and reaching behind. It made me laugh because I was thinking I was a kid. Okay. This is a long time ago, but talk about coordinating efforts across the United States of America.
Yeah.
I was in Arizona. I grew up in California, but we were in Arizona so we could go do this, which was Hands Across America. Right. So I don't know if you remember that, but that was literally getting in line and holding hands across the United States. We didn't have cell phones. We didn't have anything like that. It was just, so we can do things, we should even be able to do things a lot better today with the technology we have in front of us. And, I was thinking about that voice we need to be a unified voice. It's more powerful when it's unified. Otherwise, it's just noise. It's just noise, and no one's listening. And I don't know about you. I mean, I guess as I'm getting older, I'll sit in a restaurant or something, and we'll be talking to people, and I might be right across from them, but I'm like, am I only hearing like half of what you're saying? Because there's so much noise that, that white noise that some people fall asleep to, that doesn't help me. It muddles my ability to focus. And so being able to really focus my energy there is one. But then once we make that noise concerted, then I can hear, right? If you're at a concert and everyone starts to sing, well, what they're saying. Sometimes what they're singing as a concert of individuals in the, out in the stands is almost better heard than what's on the microphone because of all the loudness that's around you, right?
Yeah. It reminds me every time that I go to the symphony or to an opera or to any live performance, right? You have a cacophony of sound. You have the performers getting ready. You've got the pit orchestra, right? Everybody's playing and tuning in. And then all of a sudden that magical moment happens. And it's when everybody stops focusing on kind of them as the individual and they tune into the team or the part of the production that they're a part of, right? And it's when the orchestra comes together and all of a sudden the strings align, right? And the tone becomes one. The focus is just on the mission. And that mission is, right, in that case, delivering a performance. And it sounds like what you're really doing is asking, your call to action is, hey, let's all turn our focus to this one very specific thing. Let's tune our instruments. Let's focus our message. Let's make our calls to action very clear. And when that happens, it is difficult to not pay attention to that singular note, to that singular moment, because that's what our brains are wired to do. And when people also see this very clear way to add their voice to this message, they know that it's going to be amplified in the most powerful way.
Yeah. I mean, it truly is. I love what you said there. We are doing it in concert, and every instrument can sound different and has a different pitch, a key, whatever. However, when it's concerted, when it is brought together for one purpose, and that may be, in this case, it's the song, then it sounds beautiful and it's heard, because otherwise it's just noise. And so that's our chance. I think, I think, with something like BariNation, you have the loudest voice if you want, right? And, but to give it the most focus, that's how we can be powerful. I think about a story that a patient was telling me that they had been denied coverage. And then this was when they were using X pretty regularly. And they actually went on at the time, Twitter, and said, at whatever, I'll say insurance company. I don't, but at insurance company, can't believe you denied blah, blah, blah. And the next thing the insurance company is responding to their tweet because they don't want negative. And that patient's stuff got overturned. So a single voice can be heard, but it was a one-time thing. They didn't change their policy, nothing like that. However, how about those same focused voices in concert with all of their voices going straight at that same insurer and saying, okay, well, it's not just one. Now there's like a million of us. So how are you going to make sure that you're going to help us get the care we deserve? We deserve, right? It's not the care that we want. It's the care we deserve. Right.
Well, I want to go back for a second and just say, first of all, thank you for your service. You had a long, distinguished career in the United States Air Force. I come from a military family. And as New Yorkers, we've got someone in the NYPD, FDNY, Department of Sanitation, everywhere we turn. I did not realize that your decision to go into the military was based on 9/11. I worked in the Woolworth building, which is 2 blocks away from the World Trade Center. And I think we certainly feel it in New York, but not everybody really gets that we're still having people die as the results of 9/11. And I feel like the connection of that to the epidemic of obesity really doesn't always play through. There are so many people dying of obesity related diseases. And most people are looking at this as a cosmetic procedure versus a life-altering, life-changing, and quality of life extension. If there was a surgery that we could perform on any of the first responders who bravely, dug out from what went to the pile to the pit for months. And I watched that from my office window for months. If there was a surgery that we could give to any of them to stop the cancers that have come out of that, I can't imagine that anyone would object to that. But when it comes to the disease of obesity, there is still this, no, you have to do all of these other things before you prove to us that you are worthy and able to handle a surgery like this, and then even the adjunct treatments of medication. We both have had bariatric surgery and are in a position where adjunct therapies are necessary, but unable to get them through our insurance companies because they don't think that our health is really on the line.
Well, you're right. It's kind of when you were kind of saying that, it was the thought popped into my head that, when people still see it as a cosmetic thing, they think that patients who have this disease, they think that they're just irresponsible. It's a lack of responsibility to their own self. But I mean, are cancer patients irresponsible? No, I mean, they're not. They literally have a disease. And yes, do some cancers have an association with smoking, for example? Okay. Is that their fault? I kind of believe that they would have had that disease come forward. Maybe later in their life, maybe the smoking accelerated the, visibility of the disease. But it is a disease. And I actually really do like using the cancer comparison because, as you said, when someone has cancer, no one's questioning. They're not asking you to, well, why don't you just go home and why don't you just do this thing and that thing? And maybe if you try this behavioral modification, your cancer will get better. No one's doing that. If you have cancer, your closest friends are trying to figure out how they couldn't have gotten you to the doctor yesterday. Right. And when somebody says surgery for, their cancer, people are like, absolutely. Oh, a second one because it came back. Okay. A third time. Oh God, nobody's questioning how many surgeries you have for cancer. So when it comes to the disease of obesity, getting surgery, while it seems extreme, happens to be still the most durable and most effective treatment for the disease of obesity, period. Hands down. There are some great medications, but they don't have the long-term data and they don't hold on for as long as that is. So, that's really, really important. And on top of that, the pairing to the cancer model is just like you said, Christine, you said adjuvant therapy. So there are patients who have this disease who medications can help them to start. And I consider that neoadjuvant therapy, just like in cancer. Maybe that's all you need. Certain cancers respond to the medication. They're downgraded and actually go away and are just watched. But certain types of cancer require surgery. And that's all they maybe ever need. But some of them, they require both, and maybe it is neoadjuvant surgical with adjuvant therapy. And, while we're still learning to determine what patients' disease of obesity is, because when I say cancer, that's really, all encompassing, right? But if I said breast cancer, then endometrial cancer, if I said prostate cancer, or testicular cancer, or pancreatic cancer, each one of those acts so differently. And so no one questions, but when someone has this severe disease of obesity, but we don't know how severe, we can only know severity by other diseases that they have, or the higher the BMI is, we put something to that, even though BMI is not perfect, right? We do understand there's a severity to it. And so someone who has this very severe disease needs treatment with medical and surgical treatment, to really get them to the place they need to be. It's just not fair though if you can't offer it, right? And, somebody has a coronary artery bypass and it goes down. No one's saying no to your second one or third one. And, we do, where I'm at, we work with a lot of transplant patients. no one at all questions a second transplant.
Yeah.
And I can tell you that, just from a transplant world, that surgery certainly outweighs the cost of a metabolic surgery or even a revision metabolic surgery in general. I mean,
Yeah. There's this weird thing that happens when you introduce obesity to the conversation, because it's instantly paired with willpower and personal decisions. But that willpower and personal decision model could be applied to any other disease that exists on the planet. There are factors that are contributing to any of these things that humans can experience. But when it comes to the disease of obesity, it's like that personal factor is elevated to the top instead of where it is with these other models. And every time that people use the cancer situation, right, to help us better understand obesity, I think of my grandmother, who has lived through 3 different diagnoses of breast cancer. Every time she needed a different type of treatment, but every time her care team was like, "We're so proud of you. You've lived healthy. You've eaten really well. You've moved your body. You've taken your vitamins. You've been fastidious about your education. All of those things you need to keep doing them. But now we're going to do this therapy on top of these. And because you're doing all of this right, this therapy is going to work in a way that we hope will lead to the remission of cancer care." It's the exact same scenario when I think about myself and every other person that I know is battling the disease of obesity. We are doing everything right. We are eating well. We are moving our bodies. We're tapping into community. We're doing all of these things well. We just need this additional thing that is going to make all of this work at its optimum. I need this treatment, this, major modality that's going to help all these other things. But yet as patients, we discount all of the work that we've been doing for so long, including not giving up on ourselves, including being resilient and being curious and leaning in, right? It's just, we have to beg almost to get this one other treatment that will help all of these other things work really well. But there's just such a disconnect. And it's that shame and that stigma that we know you're going to carry forward from Dr. Rogers' presidency.
Absolutely.
And that leave no one behind, I think, even though it's not overt, absolutely speaks to that shame and stigma. Because when we don't leave anybody behind, we say, "I see you working through shame. I see you fighting this bias and this stigma. And that's okay. I'm here to help you fight through that. I'm not going to let those things win. We are not going to leave you behind, even though you are still struggling with these things." So it's a powerful model that we can all carry forward. And I know that your initiatives, the how behind it is really going to get us there. So would you mind, will you share with us, what are your initiatives for your presidency ahead?
So, I think kind of going along the bias part of it and the theme, I teach, I teach here at UT Health in San Antonio in our medical school. And, we used to every year have a lecture, for the 3rd year students on obesity. And, it was a 3-hour lecture. We had one of our OBGYNs who did obesity medicine, taught the first part. I taught the surgical part. We had a psychologist, usually come in for the other part. And then we would do breakouts. And unfortunately, just because of directives, that had to be, put on hold and other things moved into its place. And the sad part is, so it made me really think about it, is obesity being taught anywhere else? And I just don't think it is. And so Dr. Rogers, and it really started with Dr. Lemasters, carried forward with Dr. Curian, and then Dr. Rogers, really brought it together with our CEO, Diane Enos, the Obesity Summit. So I'm not sure if she had talked about that in the past with you, but this was a public education campaign in our mind. Initially, it just started out, and I'll say small idea, but it really evolved into something totally different. And so I had already had this idea in my mind about this obesity curriculum in medical education. And that I think that we aren't helping our doctors know early on in their career that this is a disease. And so if they don't think it's a disease, it is not going to be carried forth as a disease when they're older. And so our patients who are sitting there wondering and hoping And because, whether people like the idea of paternalistic medicine or not, I'm not saying it's ideal. We go back, that's the 50s, your doctor said, do it, and you did it, and that was it. And, but also I do believe patients, whether they like that part or not, and I'm not a paternalistic, I play it out however the patient needs me to be. We work together. Okay. But some people just need to be told, they want to be told. And some people are like, no, I want shared decision making. We're going to do this together. And it's great. But if someone's not going to tell them that they have a disease, then they don't believe they have the disease. Mm-hmm. And I'm usually the first person to tell a patient that they have the disease of obesity. And I make people cry a lot, but not in a bad way. It's just when they finally hear someone tell them that it's not their fault, then it's an emotional release. And, we need to do that on the front lines, right? These are our frontline people. But when I was a little myopic in my idea was just medical schools, we had this obesity summit, as I said, put together. We brought 40 groups of, from very different, backgrounds. We had the American Medical Association was there. We had, the American Academy of Physicians. We had the Nurse Practitioner Society. We had the PA Society. We had the Lipid Society. You name it is there. And a lot of other great, we had industry partners as well. And what I kept hearing throughout the summit was education, education, education. I actually got to get up and do a fireside chat. And I was like, you won't believe this, guys. This is what I've been thinking. And I want to thank you all for reinforcing again that I'm not crazy. Mm-hmm. But my myopic part of it was I was thinking medical school. I had forgotten, which is a sad thing, but I have it now and I'm not leaving anyone behind. But the nurse practitioners and the PAs, they're our front lines in almost every instance we go to, whether it be in urgent care, whether it be in an office, or they have their own practices as well, and so I think it's really critical that everyone, and they all said we lack obesity education. And so I was, again, fortunate enough, although it was intentional, as I found out afterwards, Diane, when she was doing the seating chart for people, put one of the physicians who's the head of the American College of Physicians and leads their exam. And we chatted and, he said, Rich, it's the reason that it's not tested is because it's not an organ system. So while obesity affects almost every organ system of the body, it's not an organ. Because when we're teaching, when we're going, we're learning about brain, we're learning about heart, we're learning about kidney, we're learning about, the liver. We're learning about the diseases that go with organs. But obesity doesn't have one. So
it just affects everything.
Right. But it affects everything. And the sad thing is we're all just, trying to, close the door with the storm, just trying to treat the hypertension and treat the diabetes and treat the sleep apnea and all forgetting that there's this root cause. There's a root cause. If we treated that, so in our program, we're blessed to work with our transplant team, which is just phenomenal. They're just a great program. We've been doing a living donor liver transplants and sleeves at the same time. Very new thing.
Wow.
But so what's interesting thing is the reason I'm bringing it up is, so when I have a patient who wants metabolic surgery, they come to see me in my office. They've already been researching it 2 or 3 years. They have an idea, they get it, and they know what else is affecting them. So I see some of these patients, my whole group, we all see them. They'll come in, and one of the best stories I have is a gentleman who came to see me, and he came and he's like, I have no idea why I'm here. I need a liver transplant. They said, I have to see you. I don't want to see you. I don't want that surgery. It sounds crazy. I don't want it. And I was like, okay, wait, let's back up. First of all, you're accepting that you're getting a new liver, right? Like we've established that that's okay, but you're worried about me doing a little sliver of your stomach and taking it out. And let me help you understand that. Wait, you're type 2 diabetic? Oh, wait, you have sleep apnea? And you have hypertension? Okay. I said, I love what they're going to do for you to give you a new liver, but turns out that the thing I'm going to do, which is kind of bothering you the most, is actually going to impact you the most. Yeah. And we're doing it for several reasons. One is, and so, the end of the story is he ended up doing it. We talked about it. He is no longer type 2 diabetic. He's off his hypertensive medications and he's not using a CPAP anymore. Mm-hmm. And he couldn't be happier. He loves his life. he's doing very, very well. And we're seeing, we're following his liver. His liver is staying protected and not getting that fatty liver disease again that led to a cirrhosis, which is why he had to have his transplant to begin with.
Oh my gosh.
So it's, again, sad that this gentleman had these other three things going on with his disease of obesity. But if he didn't need a liver transplant, he probably never would have come to see me, because he had this bias. He had his own bias.
Yeah. Yep.
And that's hard.
It's hard.
It is hard.
I was lucky enough that my surgeon, Dr. George Fielding, who I'm sure he was my consulting surgeon. He's not only, a world-renowned surgeon, but he's also a bariatric patient himself. And when I finally went into his office for a consult, because I had done everything, as I think almost all of us do before, if we just do this one more thing, he said the words to me, "This is not your fault, but let's fix it together." And that was a mind-breaking moment for me, because I had always been listening to doctors' orders, and I have a great medical team. They were not judgmental. You're doing everything. How about we do the thing that's going to, and I was the one who was resistant to it. And now why I'm so passionate about trying to get people to think about it 3 steps earlier or 4 steps earlier before it's suffering even more. But having that perspective of someone like Dr. Fielding is great. And we would love to be able to get so many more medical professionals, because you are right. Some of the bias still exists in the medical profession itself. We hear it from members of BariNation every week after they've gone to their annual appointment. And, someone asks them if they're pre-op. That they're giving them unrealistic calorie goals for the rest of their life, and still looking at this as purely a reduction in caloric intake procedure versus the metabolic reset that it really is that can, have such long-term positive impacts.
I have a real world example from this morning. I had a doctor's appointment, and they were reviewing my medical history, and they'd said, "Oh, you've taken weight loss drugs in the past." And I said, "I've been on anti-obesity medication." And I had to say that twice. And finally, on the third time, I was like, "Can you please go into my chart and will you show me where it says weight loss meds?" And it said it right there, and it was in an editable spot. And I said, "Will you please delete that? And will you write anti-obesity medication?" It makes a difference. I wasn't taking those medications to lose weight. I was taking those medications to treat my lifelong and chronic disease of obesity. And I'd like that accurately reflected in my chart. And the look on both of their faces was a little bit of, okay. And I said, it matters to me and it matters to the world, because I went through bariatric surgery not for weight loss. I went through bariatric surgery because I had chronic sleep apnea. My A1C was elevated. It was impacting my ability to physically live my life. That's not weight loss. That's a disease. So it was a teachable moment for me, but I've also been doing this 5.5 years. I feel a little bit more confident in that. But what we're, I guess, describing is just this bias and this lack of education, and just this how we even talk about it is prevalent at every level of the medical field. So to know that this is one of your initiatives is to help educate people, not only at the very top, but in every level at those front lines, like what you said, is how we change the conversation and make it more approachable for people who just want help being healthier.
Yeah, no, I totally agree with you. By the way, Christina, I respect Dr. Fielding and I have known each other for a while. And so the way you said that, I can absolutely see him saying it that way. He just is he has such a great, kind heart. And to hear that, that's wonderful. I would say, April, the way you're saying is you have learned how to speak the speak and, talk the talk, right? It's important because you have to educate people about that and how to use those words too, right? Because, words matter, right? And it does matter. You're not just losing weight so you'll find it again. You're on anti-obesity medications because you have a disease. You call them antihypertensives. You don't call, although I know people do say blood pressure medicines, but that having been said, there's no stigma to blood pressure other than people who are stressed out. The reality is it's different. It's different. And we're trying to send a message. and along with that education, I realized that, I was early in my career when I saw patients undergoing, metabolic, well, we didn't call it metabolic then really, but bariatric surgery then.
Mm-hmm.
And, I could see that difference. And I would say as an adult learner, I learned to kind of get rid of the bias. So, because I had some concerns, right? One of the concerns is a lot of our folks who are out there been practicing, are you really going to be able to affect change for them? Because they're kind of set in their way. And that's why I thought, getting people at the beginning, but I think we have to get at the beginning and we have to continue to work with those who are already engaged in the practice, and how can we help them see past that a little bit. And part of that is, so that obesity summit we did, so this is carrying on with Dr. Rogers, is, we're not going to let that go. We're going to have that every year. In fact, we're going to try to tie that around one of the meetings that I have. So that's a multi-year project, and there's a lot of money involved in it in terms of making sure it continues to occur. And we have, measurable objectives, measurable outcomes that we can have for that, so that we are advancing things along. And we're collaborating in ways we've never collaborated. And so truly the Moving the Needle campaign, that is really what we're trying to do with that. So that ties to another initiative, which is, advancing access to comprehensive obesity treatment. So again, making sure those people who know that they are eligible actually can receive the care, but they can receive it, and they, as we said, deserve it. I wish I was remembering it exactly. There was one of the things that came out of the meeting was said so succinctly. Dr. Lemasters actually said it. It was a set of 3 things, but the bottom line was you deserve the care. But it was 3 bullet points. I'm sure she'd be able to recall them easily, but they'll be out there. We're going to be sharing them, I promise, because it was just so impactful. And so that a patient understands that they deserve that care. And then kind of the last thing is a sort of strategic, is just wanting to make sure we elevate our organizational impact, and really trying to improve our image. I think that the most popular things out there may not provide the most accurate, daily life of a bariatric surgeon image. And I just think so. I think we could do better. We could be better stewards, and we just have to help each other be the better stewards for that. And like I said, when we have opportunities to be at patient conferences, there was one in San Antonio years ago. I actually have a thing hanging up in my office of patient who had, I like Superman. I wear a Superman shirt in the operating room, and it's just a thing. We used to, we couldn't wear the caps. I had a Superman cap. We couldn't wear it. I went to the shirt, and then I'd have patients who are like, "Are you wearing a Superman shirt under there?" And I'm like, "Yeah." But then all of a sudden they just relaxed. So I love the ability that I can make someone relax at probably one of the most stressful times in their life. So I love that. So one of the patients painted a Superman symbol, and put my name on it. And so I've got it hanging, but I was at a patient conference, so you have different ways. You don't realize who you're impacting.
Yes. We have the honor of being a part of that impact each and every day. We partner with surgeons and practices around the nation. And the reason that we like to partner with them is it helps kind of break down those walls or barriers or even stigma that we as patients can project forward onto our providers, right? It's that white lab coat kind of syndrome. It's like, they're not going to listen to me. I'm going to sound silly if I ask a question. Right. And when we invite them into our community to host just Q&A sessions, right? Or they lead a class, or they join us on this podcast, it's humanizing them in a way that is accessible to patients. And I think it also works from where you're seated as well. Sometimes it can be scary. You don't want to say the wrong thing, or you're worried you're not going to be received well by patients. But when we just create these moments for practitioners and patients to gather and just be humans together, really amazing things happen, right? It's where the connections are made. It's where the questions are asked, but it's where the aha moments happen. It's where a patient finally goes, "Oh my gosh, I understand this now. I understand what you mean when you say it's a disease." And from a practitioner to go, "Oh my gosh, I didn't understand that if I just said this one thing or I provided you with one resource, that would be the thing that would unlock treatment on your end." So it's just the most magical thing to witness and be a part of. And one of the many reasons we're so thankful that you're giving us your time today to have this very human, real conversation about a very big thing that's impacting all of our lives.
Oh, I appreciate, the opportunity to do that. I enjoy these kind of, sit down and talk and just like being able to, what's on your mind and what can we learn from each other and how can we unify our message and, how do we help the most people we can help? I mean, that's just at the end of the day. We want people to know that they can get that help.
Yes.
It's just, that's why we're here.
It is why we are united, right? In our efforts to not only improve how obesity is treated in this nation and in this world, but ensuring more people access the treatment at a moment that is right for them. That is the mission. Yeah. So, Dr. Peterson, knowing that your theme is leave no one behind, and you've kind of outlined your initiatives for us, how do you see patients? How do you see us helping you live your mission and continue on Dr. Rogers' mission of reducing shame and stigma?
Yeah, that's a great question. I feel the Dr. Rogers part is probably easier because, April, you can do exactly what you did today. You can go and help educate someone and I think patients need to leave their egos at the door, just like the doctors do and all of our healthcare providers need to do. Leave your ego at the door, come forward. Because if you're talking about, hey, you don't want to be emotional, you don't want to be, but it is frustrating to you to hear that you're on weight loss medicines again. But if you're able to convey to them, no, this, I have a disease and it's an anti-obesity. It's because I have the disease of obesity. It's an anti-obesity medication. That'll help them understand. And maybe, then it gives them a new context. It's not just the cosmetic. Because unfortunately, there's going to be cosmetic, right? There are people who may not really be suffering, but they're about to go on a wedding. I mean, it's just, there is that piece of it. The vast majority of people looking for care are not doing it for cosmesis. It's just not that. It's not what that is. So getting rid of the stigma, however we can do it, editorials that go into your local papers and whatnot, writing something. Because I remember, again, had this beautiful article written and then some editorial came up and said, put the fork down, man. It's like, okay, you definitely are not even anywhere near the target. You have no idea. But being able to combat that a little bit, I think is really important. How can your voice amplify what we want to do? I think we're all in this together. So surgeons aren't just advocating for surgery because, we have kids in college and we want to be on big fancy boats or any of that. I mean, the depth of the truth is we go into this profession to help people. And that may seem very corny, maybe is on most of our medical school statements and why we want to be a doctor or something. But the reality is that it's just the truth. And so if patients can advocate on their side to elevate not only the awareness, but also the bias that goes with each insurer plan, right? I mean, why does one insurance plan say no supervised weight loss? Why does another one say 3 months? Why does another one say 6? And why does one make somebody do a year? Why are those there? Why are those barriers literally there? Because people have to take pause before they have a surgery? Or is it because maybe there's a hope that there won't be that? So trying to help us take those barriers down, I would say fighting this on, from multiple directions, not different fronts. I think Napoleon lost because he fought too many wars, too many fronts. If I'm trying to recall my history, I don't recall it exactly, but I think that's the case. I think that's where people said, don't fight a war on multiple fronts. So we need to come together. It doesn't mean we can't flank them, but we do need to go in. And I watched Braveheart enough. I love that. Did some stuff there. Didn't work out so well for Braveheart. But anyway, overall, I think it was a pretty great movie. If you see me next year as I'm on my president the stage with the blue paint and the stuff, just know, and I'll be screaming freedom or something. I don't know what, but trying to say, I tried to help.
Peterson's gone off the end.
Treatment. There you go. That's it. I love to see. This is why we're together. I'm not going to scream freedom because I'm not going to try. I'm not trying to rush out of the presidency. I'm honored to be a part of this, but maybe I will scream treatment. Yeah, that sounds like a great plan.
Well, we know you're going to have a spectacularly busy year ahead, but we really hope that you'll join us at some point in the midst of your presidency to check in and have everybody kind of get that that rallying cry again. Oprah
just
is
let me
there
know.
for
I'd be honored.
Oprah's is doing non-paid, influencing for GLP-1s. You've got us, and we're here to amplify all of that messaging.
Yes.
I love it.
I was thinking about what we as an organization, what we as a nation of patients can do to support you in your mission. And when I look and I see Leave No Man Behind, we're going to continue to do what we can do to support every patient in every stage of this journey and truly work to not leave anybody behind, no matter if they're just thinking about surgery, they're frustrated by what they're living through, or they're 10, 20 years post-op. We are not going to leave everybody behind. And we're going to ensure that people know treating the disease of obesity is a team sport. This is not a one man, a one woman job. This is truly a team sport. So we are not going to leave anybody behind in that. When and I'm looking at your initiatives here, right? When you're talking about obesity curriculum and medical education, what we can do as patients is continue to be curious about what the disease of obesity is, how it manifests in our lives and the lives of others. And we can ask for obesity education when we are connecting with our care teams, right? So we can have those conversations when we're with our care team.
I want to add to that real quickly. So also in that very moment, right? One of the family practitioners I worked with he really didn't believe in it, didn't believe it at all. And still sent me a patient, and I took care of the patient. They did very well, and they went back, sent me another one. They did well. And when they're off their diabetes meds the next day, they're kind of surprised. His third patient he sent me was a family member. But he got educated, not by me saying they're doing great, although we talked. He got educated by you, the patient, because that's what made the change for him. And he refers patients to me all the time. And now he's actually practicing about 90 miles from here, and I still get referrals from him all the time.
Yeah.
So that to the impact that I just want to tag on to what you just said. You absolutely, if you can share your story, if patients can share their stories with their primary care doctors and say, look, this is how I'm doing, that has an impact. And if there's enough people, and there are going to be some who don't do well, I get it. They have some complications here and there, but that message, the positive message, is the one that's kind of being missed.
We speak about this all the time. And last year at one of the meetings we were in, I believe you might have even been there, Dr. Peterson, when Dr. Rogers stood up, or it might have been Dr. Curian, regardless, they stood up and said, patients make the decision to have bariatric surgery, not because necessarily they've heard it from their doctors. They make the decision because they've talked with other patients. They've had deep, meaningful, insightful conversations with other patients, and that conversation empowered them to make that decision. So we left that meeting really being even more deeply grounded in our mission, and that is to connect patients, right, with other patients and with experts, because we need the education as we go. Many of us make the decision to have surgery, not really understanding it's a disease. We make the decision to have surgery because we are taking a leap of faith, and we're tapping into this hope that lives deep inside of us, that knows there is a solution to what we have been struggling with. There is a treatment out there. So we go into it with that hope and with that faith, and that is enough. But as we go further away from surgery, we realize, I really need to understand what this is. I really need to talk about it. I really need a deeper understanding of what ongoing treatment looks and feels like. But it's in those conversations that hope is inspired in others who are not yet there. So very much appreciate you calling out this need for patient stories to be shared and amplified in a way that not only reaches people, but on the platforms that people are living their lives on. It's how we can move the needle.
We all gravitate towards what is similar, right? And so your story, it just has to resonate with one person to impact them, right? And so that's huge. And, that's why those campaigns were so popular early on, is sharing patient stories. And it was always pictures. You had the befores and afters, but having a patient come, and those are impactful. That's impactful. There's no question about it. But also, well, wait, they had this, or they were that, or wait, I do this and they do that too. And oh my gosh, like what that could be me, that changes. And my number one referral is word of mouth. It's just true. It's just patients talk to patients.
Yep. It's how we can reduce the shame and stigma. It's how we can encourage people to think about treating a disease in a different way, and to just get curious about what life could be like when you approach this thing that you've been battling for probably your entire life in a little bit of a different way. That's how it gets done. Dr. Peterson, thank you so much for joining us today. This conversation was amazing, and we can't wait for everybody to hear it and share it. We are very much looking forward to your presidency and getting to know you more in the year ahead.
Well, I appreciate you giving me the opportunity to share, and you actually helped me by being here today to kind of verbalize it the way that I hope it gets put out there. So I am grateful to you all for this chance. So thank you.
Thank you all. And thank you guys for watching and listening to this episode. All right, friends. See you soon.
Bye-bye.
That wraps up another empowering episode of the BariNation podcast. If you enjoyed today's episode, keep the conversation going by joining the BariNation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at barination.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at barinationpodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.